Well, wet age-related macular degeneration has been revolutionised by this treatment. Unfortunately, we haven't managed to get a treatment that's one-off. And the medicine that we give to the back of the eye via these injections only really lasts about 4 weeks to possibly 6 weeks. The idea behind the medicine is to shrink the blood vessels associated with age-related macular degeneration, but it doesn't last very long, and we need to give repeated injections to get a sustained response to eye, to make sure those blood vessels shrink completely and don't go back to reforming. Now, there are some patients who respond quite well to about 3 or 4 injections and don't need any other injections thereafter, but the majority of my patients require maybe 10 to 12 injections over 2 years. There are some numbers of patients who need further injections after that, but generally in the 3rd or 4th year the number of, or the frequency of injections is much less, and the majority of my patients get to a point where the blood vessels do shrink and they don't come back again, and the vision is restored long term. Now, you'd always be monitored once your treatment's been stopped, because we don't want you to develop a problem in the future, and that's the advantages really of private healthcare, is that in the NHS, unfortunately, there's a delay sometimes to when you get your treatment, and sometimes you don't get the intervals, so you may need interval treatment every month, and it may be pushed to 6 to 8 weeks, and you do get this sort of suboptimal treatment if that does happen, and that's unfortunately due to the constraints of the National Health Service. But in private healthcare, we have a very strict regime where we get our patients in on time, and with me you'll get an injection every month if you need it, according to the medical evidence, to treat you effectively. Now, if you want to discuss any of those further options with me and how we treat and what interval you require, then please feel free to phone the number at the end of the video and we can discuss that in greater depth.